warmers on this, however, so there's no seat warmers for the winter time.
Aren't those buttons fun?
Yeah.
Adam had that in
I
here the
like a
other
little
day.
fan that just go up my skirt here.
I have one in my office that plugs into my USB drive
Uh-huh.
and it blows a ton of air. It's great.
Did you ever figure out why this rings even when you have it on silent?
I've never figured it out. I don't know what happened.
Yeah. You know what? I can't get to work and maybe I need to turn it off and start it again. But the entire time, my texting from a thing on my phone, I'm not getting any of this stuff. So when I got on today to look and see, I had like 10 messages. I felt so bad because I didn't see them on my phone when I was traveling.
Yeah.
So, I think I like the t-shirt look better. No.
Oh, before? Yeah. Otherwise, I sweat this shirt like nobody's.
Classing it up around here. Sure. Hey.
She's gonna last later.
Yeah. Bless you. So I think the recording started. Jackie, you and Kayla and Jennifer, you guys ready? Ready? Awesome. Well, we're coming up on 6 o'clock. So I'd like to open up the County Commissioners' regular meeting agenda for August 17th, 2021. I'll call the meeting to order, and Commissioner Ibarra.
Here.
Commissioner Richardson not yet here, and Commissioner Gosar is here. If you would stand and join me for the Pledge of Allegiance, I would appreciate it.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all. Item 3, public hearing. We have none. Item 4, comments from the public. Will start here in the room and then go online. Are there any public comments here from the room? All right. How about online? Are there any public comments to be shared with us online?
Christina is going to speak.
Oh, okay. Excuse me. Christina,
Sorry, I
and
just
then
didn't announce as I
we'll-
came
Okay.
up to the podium. Can I go ahead?
Sure.
Okay.
Please. Sorry about that,
So-
Christina.
no, that's okay. So I had called Sue yesterday, and I apologize that I'm doing this in public comment, but I didn't get the email until yesterday, so we can do it more formally if I'm approved moving forward. Before you, I just handed a small packet. Last year I had applied for a scholarship through the Private Institute, which is the Association for Risk Management and Human Resources, and was awarded the scholarship to attend their training last year. But due to COVID, they canceled the training. And of course, none of us attended. Well, I received an email yesterday that they carried forward my scholarship and asked if I would like to attend this year the conference in October. It's the last week in October, the 25th through the 29th. The reason I'm coming before you today is because I had already booked and purchased my Sherman conference, which I typically attend annually, which utilizes all of my training budget in the amount of $3,000 that I'm normally awarded. Not knowing that I was going to get the scholarship, I would still like to be able to attend the training. In the packet, you'll see the agenda that's there. It's heavily focused around employment law. There's topics in regards to law enforcement, risk management for the county, insurance, many topics that I would be interested in attending the training. So the reason I'm coming before you is before I can respond to the committee on whether or not I can accept the application or the scholarship, which I have to respond by August 20th, which is before your next meeting. Because I utilize my training budget to attend SHRM, my scholarship only covers the registration of the conference. It does not include my hotel, my airfare, or meals. And so I put together a quick estimate for you. The hotel is $159 a night. And when I looked at flights today, booking for that time frame, it's approximately $178 for flights. And I guesstimated about $300 for food. So I would be asking for $1,500 to travel for this conference approximately. As I shared with Sue yesterday when I called, I did not use my training budget last year. I know that's money that's in a general fund of some sort, but that money was never utilized. And so I'm hoping that I can be approved to attend both conferences this year. And again, the reason for the public comment is due to the fact that I have to respond before you guys have your next meeting.
Thanks, Christina. Commissioners, any questions?
Just, when is the SHRM conference?
So that is September.
Okay.
It's September, I want to say 9th through the 16th. I'm not sure of the dates exactly off the top of my head, but it's about a month before.
Okay.
Commissioner Richardson, anything?
No.
Oh, the other thing I didn't mention is the reason this all came about is our liability pool, LGLP, actually recommended that I attend this conference last year, which is why I applied for the scholarship. So they thought it was something that would be beneficial to me and to the county to be able to attend. So Commissioner Gosar, I'm not sure, I know that you don't typically take action with public comment, but I'm not sure how this works since I need to be able to respond to them by August 20th.
Yeah, we'll probably change the agenda coming up here with this, and
Okay.
then we'll make it an action item and away we go.
Perfect, thank you.
You bet. Any other public comment in the room? All right, how about online? If you just raise your hand or unmute yourself. Okay, last call for public comment in the room. Perfect. Last call, public comment online. I entertain a motion to close the public comment.
I so move.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 5, disclosures. Commissioner Rivera?
None.
Commissioner Richardson?
I have none.
And I have one, item 14. I will be removing myself from that conversation and that vote as I'm the executive director of the downtown clinic. 6, considerations of changes on the agenda. Is there any changes with the addition of Christina's?
Mr. Chairman, at this time, the sheriff has asked respectfully to remove agenda item number 13 until the September 7th, 2021 meeting, please.
Okay. And thank you. We'll remove item 13 and then do you have a place where you would like to put Christina's? Should we put it at the end or? Let's see. Christina, do you have another one of these items that we're gonna? You don't. 13.
Yeah, let's just put it where we remove
Okay,
that.
let's put that on 13 then. Any other changes to the agenda? All right, I move for approval of consent agenda.
I move that we approve tonight's consent agenda.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye.
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 Aye, all those opposed, same sign. That motion carries. And moving on to the regular agenda. Item 8, request $1,000 from community partner funds that were allocated to Laramie Reproductive Health in fiscal year 2020, 2021 that were not collected. Is Naomi online? Anybody else have any background to this? Thank you, Jackie.
Mr. Chairman, Commissioners, in fiscal year 20,
2021. The Laramie Reproductive Health asked for funds from the 1% community partner funding. Unfortunately, through transition, those funds were not requested. Naomi has approached me and asked whether or not the board would reconsider allocating those funds now. They are in receipt of funds for fiscal year 2021, 2022, but they could really use those, the appropriation of $1,000 that was appropriated but not collected for your consideration.
Thank you, Jackie. Commissioner Barrow, Commissioner Richardson, any questions, concerns? I'd entertain a motion for item 8, please.
I move that we approve this request for $1,000 from community partner funds in the amount of $1,000.
Second.
Moved and second. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 9, discuss the current COVID-19 pandemic and approve resolution 2021-026, resolution regarding compliance with the U.S. Centers for Disease Control and Wyoming Department of Health COVID-19 recommendations. Dr. Elias, thanks for joining with us. The floor is yours.
Okay, thank you for having me. Things have changed quite a bit since I was at your last meeting about a month ago. The Delta variant is now the predominant strain of COVID-19 in the United States, as well as in Wyoming. In Wyoming, Delta is causing approximately 92% of new infections. The Delta virus is 200% more transmissible than previous variants, and it results in 1,000 times higher viral load. On average, one person infects 6 to 10 people, which is similar to chickenpox, compared to the original strain or the wild type strain where people were infecting 2 to 3 other people. So this is a very different virus than what we were dealing with last year. The vaccines continue to work against all the variants, including the Delta variant. 95 to 97% of people who are hospitalized or who die from Delta variant are unvaccinated. There's no vaccine that's 100% effective, and there are breakthrough cases that are occurring in vaccinated people. Infection in those who are vaccinated, however, is much milder than those who are unvaccinated. Early in the infection, the viral load of those who are vaccinated is the same as for those who are unvaccinated. And therefore, vaccinated people can transmit the infection well. And this is the reason that the CDC changed its guidance and recommended that even vaccinated people wear masks indoors in public settings. In Albany County, the first documented Delta case was in about the middle of June, around June 14th. 5 weeks ago in Albany County, we were averaging 2.4 new cases per day. Last week, we averaged 13 new cases per day, and today we have 89 active cases. Albany County's in the orange zone on the dashboard, which indicates a moderate to high transmission rate in our county. Wyoming now ranks 49th in vaccination rates among the states and Washington, D.C., with 34% of Wyoming residents fully vaccinated. Only Mississippi and Alabama have lower rates. The states that have the lowest vaccination rates are seeing the highest levels of spread. The CDC now recommends that everyone in areas with substantial COVID-19 infection rates, wear masks in public indoor spaces, regardless of vaccination status. The Wyoming Department of Health calculates their metrics a little bit differently than the CDC does. For example, they use a 2-week rolling average rather than a 7-day average to account for lower populations in Wyoming. The Wyoming Department of Health recommends that even fully vaccinated individuals who live in counties in the yellow, orange, or red zones, according to the Wyoming Department of Health metrics, wear masks in public indoor settings. I recommend that we follow the CDC guidelines in county buildings in Albany County, including physical distancing, hand hygiene, and that everyone over the age of 2 wear a mask regardless of vaccination status.
Thank you, Dr. Elias. I appreciate it. Commissioners, any questions? Commissioner Barrow, we'll go to you first.
I do have a question.
Commissioner Richardson. I have none. Thank you. Just read the resolution for 2021-2021-026. Resolution regarding compliance with the U.S. Centers for Disease Control and Wyoming Department of Health COVID-19 recommendations. Whereas SARS-CoV-2, COVID-19, and its variants is a respiratory disease that spreads easily and sustainably between people who are in close contact with one another. Whereas close contact includes living in the same household as a sick person with COVID-19, caring for a sick person with COVID-19, being within 6 feet of a person with COVID-19 for a cumulative 15 minutes or more over a 24-hour period, or being in direct contact with respiratory droplets from a sick person with COVID-19, e.g. being coughed on or sneezed on, kissing, sharing utensils. Whereas COVID-19 is transmitted by exposure to infectious respiratory fluids, this understanding is the basis of the recommendations for physical distancing, community use of well-fitting masks, adequate ventilation, avoidance of crowded indoor spaces, practicing good hand hygiene and environmental cleaning. Whereas the U.S. Centers for Disease Control recommends COVID-19 vaccinations for everyone 12 years of age and older for the prevention of COVID-19. Whereas the CDC recommends that anyone over the age of 2 who is not fully vaccinated wears a mask in indoor public places. Whereas on July 28, 2021, the CDC published their interim public health recommendations for fully vaccinated people and recommend that all people wear masks in indoor public settings in areas of substantial or high transmission where physical distancing measures may be difficult to maintain. Whereas the Wyoming Department of Health publishes county transmission indicators, and as of August 11, 2021, Wyoming Department of Health reported that Albany County was in the orange zone and classified as having moderate to high transmission levels. Whereas the Delta variant is currently the predominant strain in Wyoming, accounting for approximately 92% of new infections. Delta is 200% more transmissible and results in 1,000 times higher viral load compared to previous variants. On average, one person infects 6 to 10 people, a transmission rate similar to chickenpox. Therefore, the Board of County Commissioners of Albany County, Wyoming resolves Section 1, that the foregoing recitals are incorporated and made part of this resolution by the reference. Section 2, that within all buildings owned by Albany County and for all Albany County employees, that most up-to-date CDC recommendations, including but not limited to the use of masks for vaccinated and unvaccinated individuals, physical distancing, and protocols for close contact with someone with suspected or confirmed COVID-19 shall be complied with in their entirety. Section 3, that where the CDC recommendations are based on local transmission rate, the Wyoming Department of Health County transmission indicators for Albany County shall be used to assess Albany County's current transmission rates. Section 4, the current requirements for use of masks within Albany County buildings shall be regularly updated and posted at each entry door. Then it's passed and approved and adopted this blank day of August 2021. Anything, commissioners, that you'd like to add to that?
I have nothing.
Any questions or concerns from here in the room? Yes, please, Roy. Thank you.
So it's recommended and not required?
What's recommended?
Masks.
Masks required.
Required.
Yep.
Okay. I want to just talk to you a minute about something that I don't like using the word hate, and I really try not to ever use it, but I hate wearing a mask. And it's because I'm claustrophobic. Anybody that's never experienced what it is doesn't know what it's like. It's just like experiencing somebody saying, oh, I can't see that person being depressed. If they've never been depressed, they don't know what that really is. Anybody physician that's ever tried to give me an MRI would probably write me a script that I didn't have to wear a mask because I cannot handle it. There's not enough Valium in Walgreens drugstore to put me in an MRI. I'll never get in one again. So when people see somebody that's not wearing a mask, there's so many people that want to judge you today and say, well, that person's a rebel or he doesn't want to comply with everything. I've complied with it because I like my job and I have respect for people that want to have me wear one when I'm in their building or whatever. But I got to tell you, it's really hard. And so I just want everybody to understand that if somebody's not wearing a mask, and I hate to see what it's going to do to 5-year-old kid going to kindergarten if they, we have no idea what that's going to be like. But I just want you guys to know that that's how I feel about wearing a mask, and I'll wear it if it's required. But it really does bother me quite a bit. I have a hard time with it. So that's my.
Thank you, Roy. Dr. Elias, could you, what's the process maybe for getting a medical exemption for that? Would you kind of walk us through that?
That would have to come from their private physician. Generally, the exemptions are for people who are unable to verbalize or be able to take a mask off in the event of a medical emergency, those types of situations. And I guess one other point of clarification, the masks wouldn't be required when somebody was sitting in their own office with their door closed and they were the only person in there. If somebody were to come to the door, come in the office, then they would be required to put their mask back on.
And if they were walking in the public spaces, then the mask would come on. Is that correct, Dr. Elias?
Yes, definitely. Yes.
Okay. Any other concerns here in the room? Stacey.
Thank you, Chairman Gosar, commissioners. I do have a concern about the enforcement of this. We had a really hard time the last time we put one of these in place, and the people who walk through the door and are very angry about it. What do we do then? Who do we call? Because I see it already and it hasn't even been put in place yet. And it's scary for our employees. You have, I just don't know who. Are you expecting that the employees are going to enforce this?
Well, should people not respect that, right? They can more than happy call me. My number is in the book and it's in the paper. I, however, have to tell you, because something is hard, does not make it the wrong thing to do. Today, I wore this mask the entire day. I took it off for dinner and I'll be wearing it tonight. Now it's easier for me to wear it than somebody else. I understand that. But we are in a pandemic. And also got some statistics here today in 5 minutes on the internet. On June 1st, in the United States, the 7-day average for cases was 12,541. 6 weeks later, on August 16th, the 7-day rolling average is 141,365, a full 11 times greater. New cases in June 1st, 15,977. New cases 6 weeks later, 252,369. We passed the largest number of people under 50 hospitalized since the pandemic began yesterday.
And I realize that. I'm not arguing the statistics. I'm not arguing, I'm arguing for my employees who have that angry person on the other side of the counter. Am I calling the sheriff's office? Am I calling one of you to come and defend my employee when you have that guy that's ready to come over the counter because he's very angry because someone is telling him that I have to put a mask on? I totally understand the statistics. I'm not arguing your statistics. I'm not arguing what Dr. Elias said, but I am concerned about our employees. And that's just, I just want that
On the record.
on the record and in your minds, because it will happen. And I think we've all of us that have been in the building before and dealt with it the last time have had to face that. So I just want that on the record.
Well, thank you,
Thank you.
Stacey, and I appreciate your office and everybody else's office who has to deal with that. I think the solution is we have two tools for this that we can think of. vaccination rate, and mask wearing. Albany County is less than 45% vaccinated as of today. So more than 1 out of every 2 is unvaccinated. And take those statistics in consideration. And if my number needs to be put on the door, I'm more than happy for people to call me. I can't imagine when they call me that I'll be changing this resolution because I'm unable to, but I'll be more than happy to explain my reasons for voting the way that I will here in a minute. I know that probably doesn't help, Stacy, but so this need to make some business cards with my name and my number, and we'll just hand it out to people that are angry about it. This is quite honestly a health emergency, and for 90% of the American doctors have taken the vaccine. Or 90%. Those are our health experts. I am not a health expert, but they are. And so I think that there should be some concern for that. Yeah, Adam, I see you have your hand up.
Sure.
Sheriff Applehands, please. Thank you. Go ahead.
I just wanted to put it out there for everybody, especially those that work in county buildings. If you do have any type of security issues with your staff, regardless of what the security issue is, they're always available to call my office and we can navigate that issue for you.
Thank you, Sheriff.
Chairman Gosar.
Go ahead, Commissioner.
Stacy, I'm just a hop, skip, and a jump from the courthouse as far as my house, and I come down here on calls just to sign vouchers and everything. I'm more than happy to come and defend this resolution and speak to anybody on the commissioner's behalf as well. So please don't hesitate to call me. If I'm available, I'll just get on my bike and ride down. Okay.
Anything else?
Chairman Gosar, can you hear me?
I can. I don't know.
I apologize. This is Tori Cricken.
Thank you, Judge Cricket. Go ahead.
I just wanted to offer this as well, and particularly for reassuring Ms. Lamb. If this resolution passes the commissioners, I am more than happy to implement. I have limited jurisdiction on the courthouse as a whole, but I do believe I have jurisdiction on the 3rd floor, which would encompass Ms. Lamb's office, the clerk of district court, as well as the district court itself. And I am more than happy to pass an order that encompasses the commissioner's resolution with respect to this matter. And to that extent, if there is an individual that comes into their office that is refusing to comply, then the district court has authority to hold that individual in contempt of court, which could carry with it up to 90 days of incarceration and $500 in sanctions as well. Obviously, that would be a proceeding we would need to have that individual appear in front of, but I am more than happy to implement that order to assist Ms. Lamb, because I know she has much more foot traffic into her office than I do. And I don't want her to be burdened by this. So I want her to have all the support she can possibly have. To the extent that this resolution passes, our office will support it in its entirety, and we will do everything we can to help Ms. Lamb as well.
Thank you, Judge Cricken. I appreciate it. Anything else? Yeah, Troy, come on up again. You bet.
The language on the signs of when this passes is usually kind of, could you guys have something clear and concise? The clerks, I usually get it from the clerk's office. They laminate them and I put them up. So if we could get some really concise language on there that, whatever you guys want, rather than us trying to make up whatever that be.
Dr. Live, could I burden you to put together some language that we could put on a sign?
Absolutely, not a problem at all. Yes. Who
Thank
do
you.
I get that to?
Jackie Gonzalez, please.
Okay, yes, not a problem. I'll do that.
Thank you. Rachel Crocker, the floor is yours. Go ahead, please.
I was just going to chime in there because I have some language that Dr. Elias sent me last week and some posters that our marketing team already made for the library. So I would also be happy to pass those along, Jackie, to you. So you guys would have that as a starting point as well.
Thank you, Rachel. I appreciate it. Any further discussion? I'd entertain a motion for item number 9.
Mr. Chair, I move that we approve resolution 2021-026, resolution regarding compliance with U.S. Centers for Disease Control and Wyoming Department of Health COVID-19 recommendations.
Second. Been moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye.
Aye.
Aye. All those opposed?
Aye.
Motion carries. And Dr. Elias, thank you for being willing to do that. And thanks for your presentation. Thank you, Judge Cricken, and thanks, Rachel, for being willing to help us out. 10.
Chairman, I'm sorry. This is Tori Cricken again. I'm sorry to be a squeaky wheel.
No worries.
I would just request, because there's been a little bit of confusion about whether or not it's quote a recommendation versus quote a requirement, that I think you've made it pretty clear tonight, but I think that it's important to make known which one it is, because obviously those are huge distinctions among the members of the public and our ability to enforce it, whether or not it's a recommendation or a requirement. So to whatever extent you can make that very clear, I would appreciate that.
Thank you so much, Judge Cricken. And I'll lean on you, Dr. Elias, if you would, please.
Yes, not a problem.
Thank you.
Mr. Chairman.
Sure.
So if I understand correctly, the CDC highly recommends that, but what this commission just did is require it in all county buildings. There are no health orders in effect that trickle down from the CDC through the state health officer and the county health officer. So it's, just to be clear, it's recommended. But what our resolution just did is require it in county buildings for our employees and everyone who comes in.
Dr. Elias, could I have you respond to that? Because I think your recommendation was to have that requirement. Your thoughts?
Well, the language of the resolution requires it. I mean, we can all read that.
Mm-hmm.
So the CDC is not able to make mandates. The governor has stated that he will not do any mandates in the state of Wyoming, which means the state health officer is not doing any mandates in the state of Wyoming, which means the county health officers are unable to do variants or exceptions. So the governor is leaving it to local entities, local businesses to do what's best for them. And the recommendation from the CDC is that everyone wear masks in indoor settings, whether vaccinated or not. And I think it's up to you as the commissioners to decide how to implement that. And if you think that you're going to get higher compliance with a requirement rather than a recommendation, then I think that's the way that you need to go.
Thank you, Dr. Elias.
Mr. Chairman, we already went. I'm ready to move on.
Right. Well, I just wanted your question answered and for the public to understand the CDC can't mandate things in Albany County Courthouse and that why there's a reason why this board and this body was taking the action it was taking. All right, we have moved on to item 10.
I'm sorry, Commissioner.
Sure.
This is Tori Cricken again. I want to make sure I'm abundantly clear, because if I'm going to enforce orders, I want to know what those orders are. My understanding tonight is that the Albany County Commissioners have passed a resolution that masks in Albany County buildings are mandated, not recommended, but required of individuals. And I'm not meaning to be harsh on that. I just need to be absolutely clear with respect to what I am required to enforce. Is that accurate?
That's how I understand it, Judge Cricken.
That was my understanding as well. And I appreciate your time, and I'm sorry for being a nitpicky on rules.
And just indoors in the Albany County buildings. I don't want there to be any fuzziness on the outdoors of the Albany County buildings. So
absolutely understood. I appreciate that. Thank you to all three of you.
You bet. Any further discussion All right, item 10, discuss making district court handicap accessible. Former Commissioner Chestnut, good evening. The floor is yours.
Might not be able to see me with this podium, sorry.
Is this
Yeah, works for me.
Evening, Commissioners. Yeah, I've been thinking about this for quite a while, but I was up in the district court for the rail tie wind project, and you guys may have seen me there. The courtroom was packed, and I felt very uncomfortable in the doorway. As people started leaving, I felt extra uncomfortable, so I moved to the front behind the bar, which may have made you uncomfortable too, myself being a former commissioner. But I think in this day and age, the Americans with Disability Act passed in 1989. And to have a room that's used by the people of Albany County to not be handicap accessible seems wrong at this point. I know that actually making the district court, the witness box and the witness stand in the jury box is going to be an issue, a much more expensive issue than what I'm asking for you here tonight. But I've talked to several contractors about this. What would need to be done to make the district court itself, the gallery, wheelchair accessible would be simply to remove a bench for a short time, knock the end off the bench, saw it down, reconnect the end of the bench, put it back in. It's going to be not an expensive thing to do, like making the rest of the district court expensive, but I think it's a first step in making that accessible to people with wheelchairs that don't feel comfortable doing it. I actually sat as a witness in the district court during the Richard Bowling trial, and not having the witness stand accessible, I was forced to sit within a foot of the jury. And I'm fine with that. I have a different personality than a lot of people do, but other people in wheelchairs may not have that. And if you have to get up on the witness stand, that's another issue. But I think what I'm asking you here tonight is if we can use a minimal amount of funds, and I asked your grant writer if she could look into it. I know there's handicap accessible money available through the federal government and the state government. I think this would be a pretty quick, simple fix. I don't think it would make it hardly any disruption to the court at all. We could work it around Judge Cricken's schedule and really not have any disruption to the court. And if you have any questions, that's just what I wanted to bring up. And I think it would be a good first step. I don't know. I was a commissioner when we remodeled the courthouse. In my mind, that courtroom should have been brought up to ADA standards at that time. There are issues that I have not gotten an answer to with the historic value of that courtroom. It may not have had to have been updated at that time, but it seems like by 2021, people in wheelchairs shouldn't have to be second-class citizens when having to go to the district courtroom.
Thank you, Tim. Roy or Judge Cricken or anybody would like to respond to any of that, and please. Okay. Awesome. Thanks, Roy.
And thank you, Roy. I would as well, but I'd like you to go first if you don't mind, sir.
Could you pull up that microphone, please? Oh, thanks, Roy.
Sorry about that. What Tim's asking for is really pretty easy to do without really too much work, I think. I've measured everything. The doorways are fine. The doorways, the clearance between the pews right now going back is 39 inches, and it's 41 between the railing and the first pew. What I think we could do and that would just take me to get some help. There's some chairs in the back of the first row of pews. The pews they're not attached to the floor. We can move them. So what we can do is we can move the chairs in the back somewhere. I don't know where we'll put them, but we'll just move all the pews back one row, and we could take maybe some stanchions, because I have several of those left over from what we had and we can make a designated area. That's where you come in and you can back into it and park, and you'll have room for a wheelchair. And it'd be pretty easy. You'd be the first one in there, and you wouldn't be in the way of somebody that's trying to walk through. Does that make sense to you, Tim? Because it would separate but equal. Well, it would be pretty easy to do. We wouldn't need a grant or really any money. I just need some work, help with some muscle to help pick up some pews and move them all back. And it'd be pretty simple, but, and if we had to put tape or a sign there that said, it's kind of like a ballpark. If you go to a ballpark now or something, there's an area where you can park your chair, but the seating is behind it that goes up or whatever, but that flat area is made for handicap wheelchairs, et cetera. And so I think I don't know, to me do you think that would work, Judge Crooken?
I do, and I have other opinions as well. So you offer what you want to say and I'll follow up.
Okay, well, all the doors are okay. The magnometer would be the only thing. I don't know if you had a hard time getting through that. Did you? Or if it was in a. Okay, because it's 30 inches and most wheelchairs can get through 30 inches, but I think it's kind of pretty tight with that magnometer. But in any case, anytime we have somebody up there needs in there, we needed to move that out. We could, I guess it's movable. Yeah, but the chair doesn't. Okay, well, that's all I had to say. I think as far as, we could do it, I think, without too much money involved or a grant.
Thank you, Roy. Any questions for Roy, commissioners? Judge Cricket, you're up, please. Thank you.
Thank you, commissioners. Can you hear me okay?
Got you loud and clear.
Great. I appreciate you letting me appear by video. I communicated earlier today that I was happy to be there in person, but I very much appreciated the opportunity to appear by video because, ironically, with the agendas, the topics on the agenda, my daughter was exposed to COVID at the high school in volleyball tryouts today. So we're here. In any event, I can say I have an institutional memory of roughly 21 years, and I cannot recall ever in 21 years a single, and that predates our remodeling and our reconstruction. I cannot recall ever an instance where there was a concern with ADA access. That said, it's an important and serious topic, and I want to take it seriously. I was involved in presiding over some litigation, and I think it was Sublette County where the same issue was really discussed, and there was ultimately a resolution. In any event, I can say this. I concur with what Mr. Torres had to say. I will say as well, I'm unaware of any concerns about ADA access other than perhaps the elevator, but that's been taken care of. I mean, our elevators are in great function at this point in time. We can remove the magnometer, which is the only concern with handicap access in terms of wheelchairs. We have had students from the University of Wyoming College of Law in our courtroom within the last 2 to 3 years. We have had witnesses testifying in our courtroom within the last 4 years. All of those folks have been able to be accommodated, and that is what we are required to do under the Americans with Disabilities Act. All of our benches and everything in our gallery can be moved if needed. But even prior to the bar, if that makes sense to you, the bar is that kind of stationary period of wood that designates the differentiation between the public and the lawyers. We can have public before the bar. We can have public testify, as we've heard from various locations in the courtroom. And ironically, this day and age, we're doing exactly that. Because of COVID, we've had to rearrange our courtroom. And so right now, our jury is seated in the gallery so that they can be spaced and provided masks and other PPE. And that's been occurring for, roughly a year. I can remember at least since last September. And we've moved our witness to a different spot. with a portable microphone, which is again even more accessible for any handicap access. So going forward, I guess in a nutshell, I'm of course always receptive to any recommendations, and our court will do anything that needs to be done on both a state and federal and local level. And if the commissioners ask me to do anything, I'll make sure it's done. That said, I think we're completely in compliance, not only with ADA, but any other laws and recommendations regarding access to our courtroom. And I, at all times, welcome any assistance in making sure that happens. I would not be providing a fair and unfettered and unjust access to the law of the state of Wyoming and to the United States, Wyoming, and the United States of America, if I didn't offer that. And so if there's anything else I can do, please let me know. Otherwise, I think the matter's been taken care of. Thank you, commissioners.
Commissioners, any questions?
None.
Commissioner Richardson?
Yeah, I just have a comment. I think that that Tim is right in the sense, I think that it's up to the judge on the proceeding side of the railing of the bar. Because all of that stuff is movable, and the only thing I'd like to see is an ADA space so that at any time somebody from the public could cruise in there and not have to be accommodated or interrupt the proceeding to be accommodated. And so that first bench right there, I mean, I think what Roy was saying is you take the chairs out of the back and you slide everything back one spot, and then you have your spot for ADA and it's done. And maybe we have some stanchions or something that we mark off, to delineate that space, but I'm not inclined to micromanage that. I don't know what Judge Crichton thinks of my comments. To me, I think that somebody ought to be able to go in there and settle in without disrupting the proceedings to be accommodated. So.
Yeah, right. Please.
Stanchions, you've seen them all, that has the black stripe that's stretchy, and we can hang, once we go across it, and we can just hang something there, handicap only right here, and seating, handicap seating. We'll make a sign that says that, and it'll differentiate it, and then it'll be there for, I think it'll be pretty handy, and it's probably should have been done, but I think it'll work good. Just do it like that.
Yeah, Roy, would
And if
you?
it doesn't, we can always go back to the drawing board. If you think it doesn't work or something, we can always go back and try something different,
Would you work with Mr. Chestnut and get a plan or two that we could show to Judge Cricket? Because it would be nice if somebody who works in every
I
day.
can just walk through with Judge Cook, and I think we can just walk through and look at it, see what you think, what they think, and how we can do it, and we'll get on it.
Okay, Judge Cricket, does that sound like a workable plan, working with Roy?
Okay, I think I'm unmuted. Of course, I always like working with Roy, and that sounds great. I'm open to any options.
Awesome. Thank you so much. Thank you for working on this, and we'll look forward to the solution here, I'm sure, not too distant future. Item 11, discuss proposed amendments to the Albany County Zoning Resolution Aquifer Protection Overlay Zone Regulations. David, good evening. Floor is yours.
Good evening, Mr. Chairman, Commissioners. All right, so at our last meeting, we made a few more changes to the draft that we've been working on for a while now. On page 2, we added back the definition of best available technology. On page 3, we amended the paragraph A under 5, aquifer protection overlay zone established. Page 4, we changed some wording to a sentence concerning the reimbursement of For professional services of proposed exclusions. Most of this was just changing a few words that needed to be changed. Staff modifications on page 11. So staff modifications to criteria for lessening setbacks for wastewater systems as presented at the August 3rd meeting on page 11 there. And then page 12, we changed some wording. Nothing crazy there. We removed hydrologist on page 13. And then there was an added, or we added the paragraph on modifications that was provided by Commissioner Iber at the previous meeting. Then there was some cleanup and punctuation that was done throughout the document by Commissioner Iber. And then the only thing that I caught this afternoon is on page 16. There's probably a change that needs to be made here. Page 16, where it talks about exemptions. We had an APOZ development permit shall not be required for the following. We need to strike that APOZ development permit and then add SSI since we got rid of the APOZ development permit. So those are the changes. Nothing really too crazy from the last meeting. Just added those things in. So yeah, whatever discussion we want to have at this point, that's what was done. So.
Thank you, David. Commissioners?
David, I just want to acknowledge that you've been really good working with me and making the accommodations for me as far as all the changes. I appreciate it. And I know some of them were just changes, punctuation, but in some instances, it made a difference of how
there's definitely a few things
statement read and the interpretation. So I really appreciate that. You'll be happy to know I have no further changes. I'm ready to move forward with this.
Okay.
And get it out for public comment.
Commissioner Richardson? And I have no further comment on this. Anybody in the public here in person like to comment on item number 11, Albany County Zoning Resolution Aquifer Protection Overlay Zone Regulations. Okay, how about online? Would anybody like to comment online? Just raise your hand if you would, please. I've got this brand new technology right up here. I'm just dying to use. So, but, okay, how about your last one here? Okay, and then online. All right, I entertain a motion for item number 11.
Mr. Chair, I move that we approve the amendments for public comment of these regulations, aquifer protection overlay zone.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye. All those opposed, same sign. That motion carries. And so I guess, I reached out to the Wyoming County Commissioners Association about the sending back to planning and zoning. They said the case law was negligible and almost obsolete, but they did think that there didn't need to be a resending to the Planning and Zoning Commission. It's I'm not sure if we can, and maybe Jennifer, you can help me today. Can we send these out for public comment now for 45 days, or does that need to be done at a subsequent meeting, or Kurt, whoever would like to talk about it?
We did send in the recommendation for the Attorney General to get back. Yeah. Like in all things in the law, there's arguments on both sides, and we've had the discussion. I think if you want to send it out and we were to get something different back from the Attorney General, we could deal with it at that point.
Yeah, thank you. Thank you. So could we publish it, send it out for public comment here for the next 45 days, or do we need a different agenda and a different item?
I believe it's just on here as a discussion item.
Right.
So you would need to add an item to direct the clerk to publish.
Okay. Right.
Well, so our office will publish, but yeah, I can bring it back with the date of the meeting it'll be published for, and then we can get it in the paper and stuff like that. So if you want me to bring it back to the next meeting as a directive to publish, item, we can do that.
Okay.
Well, point of order, Mr.
Sure.
Chairman, we had a motion and a second and a vote on, or have we had the vote yet?
Yeah, you
Yep.
did.
On a discussion item, so I don't know what that means.
Well, Mr. Chair, I don't know if we really needed to do
Right.
anything. You could just direct me to put it online and this is the copy that I think it was more just saying, this is the version we're going with
Right.
tonight.
Right.
So whether we needed a motion or not, and whether we could have a motion or not, I guess is kind of moot, really.
Okay.
So that's a motion on agreement among commissioners of
Yeah.
what to do with it.
Yes, I would say.
But it's not an official act in the process. Right?
So let me make sure I understand. We could direct you today to go out and publish them. And then you could come back September 7th is our meeting and said, we went out August 18th and published for 45 days these amendments that you agreed to on August 17th.
That's not, well, I would just say that we agreed to what they are.
Okay.
I think what Jennifer was saying is that we need to have an actual action item to direct me to publish the amendments and then schedule a meeting at that time. as well.
Super. Okay. Can we put that on the September 7th
Absolutely.
agenda? Thank you. I appreciate it. Thanks for clarification on that too. Okay, item 12, present for consideration an application for annexing into the city of Laramie of the portion of Bill Nye Avenue between Grand Avenue and Sherman Hill Road and authorize the chairman to sign. David.
Yeah, so Mr. Chairman, this is the annexation request for Laradice Land LLC. So this has been on your agenda and it keeps getting pulled. And I believe that the Sherman Hills Road Improvement District is on here. So that was the one piece I think we were missing to find out what their thoughts was on it. And then if the county attorney's office is okay and the district is okay, then you can go ahead and sign this and then it would go forward through the process of the city. So what we're doing right here is all we're doing as the county is saying that we can sign off on an application as the owner of the road, since it's a dedicated public road and you're the public governing body. That's what I believe we're doing. And Jennifer can clarify anything I just said. So
Yeah,
and
could you give
listen
us
to her,
a
so-
little background on this issue, just for people checking in just today, Jennifer, and help us out?
Sure.
Thank
So
you.
Sherman Hills Road Improvement District was established for that entire area out there. And when those special districts are established, they are then a political subdivision of the state, as you know. So the reason that we reached out to the Sherman Hills District about that is because within their bylaws and within their application and petition for establishment, they specifically list maintaining, it's a road that's dedicated to public use. The county doesn't own it, like the discussion we've had about all of the roads. But as part of what the Sherman Hills Road Improvement District does is they maintain that road because Bill Nye is the only deeded access into the Sherman Hills subdivision. There is Pilot Peak or Pilot Hill, I can never remember. Pilot Peak, that is also a road in there, but that is not a deeded road. They have a license to use that road that's renewable annually or every 3 years. And Terry Lund can talk about that. So before we move forward with this, I wanted to get Sherman Hills Road Improvement District's comments, since this essentially affects everyone in that district. And also to suggest that if we are going to move forward, we need to put some language in a road vacation so that we are protecting the residents of the county, who that is their only access, so that we don't get into a situation like we have on Quarter Horse, where we have a private or a county road that's adjoining to a city street then. So for any future development or permits, because the city now has their new right-of-way permit that they require as of February of this year. So before we approve it, I think Terry Lund I see is on, and I'm not sure who else from Sherman Hills, but I know they had a meeting, I believe last week, to discuss it at their meeting. And I haven't talked to them about what the outcome of that is.
Thank you. Chairperson Lund, are you the person to talk to with regard to this?
I believe so. I am Terry Lund. I live at 2225 Rangeview Lane in Sherman Hills. And I am the chair currently of the Sherman Hill Road Improvement and Service District. And I really appreciate Jennifer having notified us, evidently after this had been on your agenda a couple of times. I don't know. We were pretty unaware that there was something happening, the possibility of this annexation. So I appreciated her informing us. We were able to meet August 10th. And I also appreciate all you commissioners having agreed to delay consideration of this until we could have a meeting with a quorum where several of our members attended. And so today I'm here to represent those few members who attended and voiced their opinions. It's possible someone else is in the audience, virtually perhaps, who might wish to make comment, who lives out here. But a very quick summary of our August 10th meeting is that those in attendance unanimously agreed that at this time, we're opposed to the idea of the city annexing this stretch of Bill Nye between Grand Avenue and Sherman Hill Road. And that opposition is largely based on a lot of uncertainty about what the plan is. We have not heard anything formal or official about the proposed development, about what the increased traffic situation would be like. And so I do have a number of questions, and I don't know if it's okay with you all if I ask or pose these questions to you at this time, or how would you like me to proceed? I don't see, is JT Walsh present, or the city planner, or someone that might be able to answer questions about what this would look like in the future based on the unknown development that's being proposed.
Chairperson Lund, none of those people do I see. Yeah, I don't know that, I think we'd love to have those questions, and then we'll forward them on to the city, because we certainly don't want to do something that is opposed by people unanimously based on information that's probably out there that hasn't been directed to people that need to see that information.
Well, and I have talked to, both to David Gertsch and to the city planner, and more pertinently, I think the questions I've asked of the city planner, many of the questions were, there wasn't really an answer, because there isn't a formal proposal for the development. At this point, what I know and what I'm most concerned about, what we know and are most concerned about, is that Mr. Walsh had approached YDOT to ask for direct access to his future development directly off Grand, and he was denied that access and told that he should pursue access off this stretch of Bill Nye that we're talking about now. And I just want to say, and maybe Heber could pitch in too, maybe, I don't know, he's got some experience out there, but that intersection is absolutely inappropriate for any additional traffic at this point in time. I understand that a development involves promises of upgrade to city standards, which were explained to me as widening, repaving, installation of curb, gutter, and sidewalk. And that's all wonderful. It still leaves us, and I don't mean just those of us in Sherman Hills, it leaves everyone in that area with an intersection that is unbelievably busy and dangerous for the following reasons. You have two exits coming off of I-80 merging right at one of our entry points, Pilot Peak Road, at 55 miles an hour. Second, you have tumbleweed directly across the street on Bill Nye with people simply pulling off on Grand Avenue to wait for their turn at the gas station. You have 130 households currently, that's our road district membership. 130 households potentially might be using Bill Nye as their egress and ingress to the neighborhood. And then you're proposing an additional subdivision at that intersection. And so my concerns go beyond what the city might offer us as far as improvements to that intersection and modifications that I believe need to be made before any construction or improvements or additional traffic might appear at that intersection. I'm suggesting lowering, I know I'm going off on a tangent, but to me, that's the bottom line. That has to happen. So I think Mr. Walsh's application is premature. Before he's even proposed a development, he wants the city to annex a road which to us represents an indefinite period of time that the city would maintain a road. And they've already told me they cannot and will not maintain it to the standard that we currently maintain it. If there's 2 inches of snow accumulation, we plow it. If signs are stolen or delineator posts are broken or bent, we replace them. If crack sealing needs to be done, we do it. And I can't get that kind of assurance right now from someone in the city that that sort of maintenance will be done on that stretch road where we're willing to keep doing it. So I do have other questions, but I might give you a minute to ponder what I've already said.
Thanks, Chairperson Lund. Go ahead, Commissioner Richardson, please.
I'm ready, man. It's pent up.
Okay.
David, can you take a few notes?
Sure.
Because I can see where this is going, and these will be, we probably need to write down the questions. And I suppose we can refer back to the recording or, because Terry said some really great things.
I'm happy to send you my little script that I have.
Okay, great. So one thought that I had, I really actually don't, and I live out there, I don't see an issue with annexation, but I would want to know that, as a commissioner and as a homeowner out there, I would want to know that there's a couple things. There's driveway permits, right? The city has a driveway permit process that I don't understand and don't even agree with. But separate from that, if they annex a road that's a public access road, and then they want to limit the access or make people go through a process that are outside their jurisdiction to have access to a road that they used to have access to, I would be entirely opposed to it. So whatever gets written up, it would have to say that, maybe there could be some agreement if somebody does another subdivision. out there, but all the existing ones and all the existing lots shouldn't have to have a new process to use a road that they've paid for and have always maintained.
And Heber, I did have a conversation with Derek Teeney about that, and at least verbally, he gave me some reassurance that we would be quote unquote grandfathered in with respect to that right-of-way permitting thing that the city passed in February. And so, like you said, that would, if in fact the city annexes this stretch of road, which I think shouldn't happen yet. Yeah, I for sure want that in writing. But I guess I gotta lapse back to saying I think that this is premature before, I mean, who's to say that the current owner, who I understand is Mr. Walsh, officially now, very recently, what if he sells? What if he doesn't develop? Derek Teeney already suggested to me that, well, you know, maybe it won't work out and we'll just go through this process in reverse. Well, if we're already thinking like that, why don't we just put this off until there's actually a solid, approved proposal for that development, and perhaps some work done on that stretch of Grand Avenue to make it safer for drivers, for wildlife, for residents of the neighborhoods that, you know, that turn off and onto that short stretch of road between the I-80 interchange and Walmart, basically. Why are we driving 55 miles an hour for less than 1 mile? There is no other entrance or exit from Laramie at which you can travel at that speed. I know that's probably beyond your consideration right now, but that to me is an underlying issue that affects the kind of, that affects this proposal to annex and proposal for additional development at that location.
David, looks like you had your hand.
Yeah, so just a couple comments. First, why the annexation before the development? That's, I believe that's a city process. They have to annex that in to get approval of the development. So that's that. Speed limit, that's YDOT.
It's the plat thing. You can't plat that access unless you.
Yeah, because
so it's a chicken and egg problem.
What I've been told is that they can't go forward with the development that shows that it's accessing on a road that's not owned and maintained by the city. And so that's why that has to happen. What I would suggest is just direct me to go back and I will talk to the applicant and just say, go and visit with the district out there and see if you guys can work through this. And then once they can come up with something, if they can give them more information about what the development's going to look like, and then the district can sign off on it and then they can bring it back. And that way it's out of our hair until they figure that out. That's what I would suggest, since this is their road. I mean, they are maintaining it. So they have the biggest interest, I think, in this. So
it seems like pretty good advice, Commissioner Rivera.
I like that. I don't think we should proceed when there's so much opposition.
Mr. Chairman.
Yeah.
I have a funny thought. Generally, when somebody does a subdivision, you know, a developer has to improve the street, especially one like this. So probably the city wouldn't be doing the infrastructure under the street, power, water, sewer, whatever it is. And, you know, the developer would do that, pave, curb, gutter, all of it. So I still can't figure out what the process is. I mean, if I was the city, I wouldn't want to annex a street when I don't know whether the developer is going to go or not, right? Because then now as a city councilor, we own a street that doesn't meet city standards and we don't have a developer to shift that cost to, right? So it's interesting that a developer would have to have, I guess, I don't know if this is just permission to annex or if this is the actual annexation. Like, I don't know if we're saying, okay, whenever you're ready, go ahead and do your process over there. Or if we're saying, you know, this is now city, right? I don't think we can unilaterally shift it to them. So I don't understand the process. I don't know I don't really know what's in front of us. And to Terry's point, and that's why the USAC priority list should have Bluebird first, because USAC money is the exact thing that pays for traffic control on that intersection. And then Bluebird ought to be renamed to Bill Nye and built wider down through there so that it can become an east-west conveyance all the way down to 3rd Street at some point. So, and she was remiss, she didn't mention the hundreds of high school kids that mean not to be late for class no matter what. It is a funky intersection, that one, and it's a little bit offset too. So this isn't something that I think can be done without YDOT's participation. This is perfect for USAC, right? I do think that the county could, on the other side of the street, on the other side of Grand on Bluebird, the county could go out there and paint some striping for traffic control to give some visual cues to people who are in that space. That's a separate issue. Anyway, so to me, it seems like the developer needs to at least draw up a plat so that everybody can see what it is, and then, you know.
We don't have much information, so
Right.
this is what they.
As a matter of fact, until Terry said that, I thought that there's sort of a purchase option. I didn't know that it had actually changed hands yet. So he closed on the property and he owns it.
Yep, I think it seems like we have agreement here. If we could get Terry's and whoever else's concerns over to the developer and or the city, and then bring it back to us when it's further down the chain, where everybody understands. Does that sound all right to you, Chairperson Lund?
It sounds good. I just have one really quick question. What's USAC?
That is the Urban Systems Advisory Committee.
Oh.
And it's made up of city people, county people, and YDOT people. And it is, you know, developers do little streets in their own subdivisions, but you have bigger conveyances that sort of serve everyone that maybe aren't part of the highway system or the county road system. And those things are eligible for some federal funding to improve them and make them safer, or so basically it's federal money, and USAC, Urban Systems Advisory Committee, is a group that prioritizes projects based on our consensus view of what is needed. And actually, that used to not be anywhere on the radar. But once the high school was built, that changed everything. And so Bluebird used to be a sleepy little street on its way to nowhere, and then it wasn't, right? So sometimes USAC's priorities have to shift just because things happen and the landscape looks different than 2 years ago or 3 years ago. But Terry, it takes a long time to accrue enough federal money to do projects that need to be done. It's pretty tough.
Yeah. Yeah, and then just a quick response to what sounded like a question from you, Heber, that it would be at the expense of the developer, Mr. Walsh, to make all those improvements to that stretch of road. And my main question about that is, would those improvements be made before construction began? Or would that stretch of Bill Nye, which currently is crumbling, I'm telling you, it's in bad shape already. And we simply don't have the funds to do the work necessary to shore up the shoulders, et cetera. But if construction vehicles were to start using that stretch of road before it were widened and improved, it would tear it, completely tear it up.
They would destroy it before they fix it.
Well, yeah, that's
But to me,
kind of
the
how we
most
feel.
important part as a Sherman Hills Improvement District member is making sure that if that becomes a city road, that the city will take care of it. After the developer builds it up to the edge of, I guess Sherman Hill Road at that point, and that everyone would be able to maintain their access, that it would be removed from the road district, and the road district, the improvement district could say, this was ours, now it's yours, and it's a clean break. You wouldn't want to have any confusion in there. And I'm sure that can be done, but anyway.
Right.
Terry,
Thank you.
Could you send a list of those questions, and if you have additional ones to David, and then David will forward them on to the city and Mr. Walsh, so that we can
Yes.
get those answered for you. So thank you, I appreciate it.
Thank you all.
All right, item 13 has been removed as it appears here, but it has been replaced with Christina's request for the Prima Conference and the Sherm Conference and the $1,500 to attend that. So is that correct?
Yeah, and that, like I said earlier, that was an estimate based on if the flights change and all of that. But doing a quick search today, that's kind of what I was looking at. And I apologize, I presented in public comment. I didn't know that you would add it to the agenda. So
yeah. Commissioner Rivera, anything?
No, I think none of us here would argue for professional development or for the education of any of our county employees. So I move that we approve these funds so that she can attend both conferences.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye.
Mr. Chairman, excuse me. Can I just make a suggestion?
Yeah.
That the funds come out of miscellaneous uncommitted in 1%.
Yeah, thank you. Thank you so much for guiding us there.
Okay, and my motion would include what Jackie just said.
Second agreed.
Okay, moved and seconded. Any further discussion now? Hearing and seeing none, all those in favor signify by saying aye.
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 Aye, all those opposed, same sign. That
thank
motion
you.
carries.
I appreciate the
Thanks,
consideration.
Christina. Learn lots. Item 14, present for approval, First Amendment to the funding agreement between the Board of Commissioners of Albany County, Wyoming and Downtown Clinic in the amount of $14,280 for continuation of emergency rental assistance services through December 31st, 2021, and authorize the vice chairperson to sign. I could probably, Tracy.
Here I am in person.
Go right ahead, please.
All right, I'll address Commissioners Richardson and O'Bara since you have abstained from this.
Yep.
What this is the First Amendment to the ERAP because the downtown clinic person wants to stay on and continue helping through the end of the year. So we need to provide them additional funding. So that amount is $14,280, and that will allow the downtown clinic to offer the services through the end of December.
Okay. Yep, from August 1st through the end of December.
I move that we approve item 14 as presented.
Second.
You can still run.
No, I've moved and seconded. I was going to enjoy it. I was in here looking for some popcorn.
Take a break, yeah.
So moved and seconded. Any further discussion?
None.
Hearing and seeing none, all those in favor signify by saying aye.
Aye.
All those opposed and those abstaining me. Thank you. Appreciate it.
And also in your agenda packet, Commissioners, was the voucher. So if you execute, but you probably have to take that back to your board before we can pay you.
What's that?
The voucher is in the
okay.
packet too. So it's all ready to go. So you have to sign the agreement, probably take it before your board.
Okay. So super. Thank you.
To help you expedite that.
I'll sign the voucher. He's not allowed to.
I think it's signing for on behalf of the downtown clinic is what I'm.
Right,
gonna
you
be
could
signing.
sign in both spots.
No, no, we cannot.
I was saying the lower right corner for me.
Yep. 15, present for approval, submittal of the Wyoming Court Supervised Treatment Program State Fiscal Year 2022 surcharge application for the Albany County Court Supervised Treatment Program in the amount of $33,495. Bailey.
Good evening, Commissioners. This is a drug court application Rebecca would normally present, but she's at a conference right now. So I told her I'd present for her. The past couple of years, the state has offered what they consider these surcharge funds, which is just additional funds that would then amend the original agreement to add these funds. So what we're asking for this year in the adult grant would be some quality of life dollars for participants, money to attend what's called a prescription drug summit training, some awareness campaign funding to print out brochures, a little money for sober events for participants, and then finally a train for change training. And that one, a trainer would be brought to Laramie to put on a training. Any questions?
If there's any questions?
No questions. I just love the quality of life component of this grant. I think that's great when so many of these issues here that are noted make such a difference in the person's health and mental health and everything. So I applaud this.
Entertain a motion for 15.
I move that we approve item 15 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 16, present for approval, submittal of the Wyoming Court Supervised Treatment Program State Fiscal Year 2022 surcharge application for the Integrated Juvenile Treatment Program in the amount of $40,596.50. Bailey, you're again, please.
Yes, so this is just the juvenile application. This one consists of just a little bit of different funding. So we still have quality of life money, some funding to attend the NADCP conference, some money to attend the Protect Children conference, more funding for awareness campaign, sober events, some actual drug tests. And then finally, the second half of that Train for Change training, it's about $20,000, and she wanted to split it over the two because it would fit for both of those.
Commissioners, any questions, concerns? Entertain a motion for 16.
I move that we approve item 16 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 17, present for approval Amendment 1 to the grant award agreement between Wyoming Office of Homeland Security and the Albany County Commissioners for the 2020 Hazardous Materials Emergency Planning Grant, CFDA number 20.703 in the amount of $109,310.64 to extend the term from September 30, 2021 to September 20, 2022. Bailey, is that supposed to be 30 or 20?
It should be 30. Yes, I apologize.
Okay, can we make that September 30, 2022? Thank you. I should have got that sooner.
This is just the amendment to, I believe in the beginning, this was supposed to be a 3-year agreement. However, it was just overlooked the past couple of years. So it is just extending it one more year. This agreement is for a contract with UW. They're doing the research on it. And I believe they finished the first part when Amy Binning was still here, and they had presented to the commissioners what they had so far, and they're finishing that up for us.
Commissioners, any questions? Entertain a motion for item 17, please.
I move that we approve item 17 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 18, present for approval, application for catering permit for Mulligan's Pub for a wedding ceremony and reception at Deerwood Ranch, 599 Wyoming 11, Laramie, Wyoming, 82070 on August 21st, 2021 from 4:30 PM to 12 AM. Kayla.
Good evening, Chairman and Commissioners. I have a catering permit for Mulligan's Pub, just as you had mentioned. The only caveat is the city council has it on their agenda tonight to approve Mulligan's to use their license in the county because they're a city license holder. So Nancy will get that letter most likely tomorrow. She's usually pretty prompt about it. So that's the only.
Commissioners, any questions? I'd entertain a motion for item 18.
I move we approve item 18 as presented.
Second.
Moved and seconded. Any further?
They gotta have some libations.
Yeah. Hearing and seeing none, all those in favor signify by saying aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Thank you, Kayla. Item 19, present for approval, contract between Wyoming Secretary of State's Office and Albany County Clerk's Office for the purpose of utilizing the requested funding to implement the Dark Trace Appliance Package in the amount of $64,476 from the effective date through December 31st, 2021. Adam.
Good evening, Commissioners. Thank you for having us today. This is an agreement. We were awarded the grant funds for our full purchase appliance for the Dark Trace security appliance. If you guys recall that you granted us the ability to purchase it, we were able to cover the purchase in full, which was great news. So this is that contract to have that done. And so there's a couple reports that they requested, all of which will be fulfilled via our office.
I think could you just give us a little bit background on Dark Trace, what that does for us?
The Dark Trace appliance for you is providing a network security appliance, network monitoring and intervention. It's automated intervention based both locally here on the network as well as our cloud environment. So any of our SaaS profiles out in the 365. So it's a lot of it's localized network and the communications doing so. Big strong point is essentially preventing ransomware at initiation as well as a spread as the universal spread occurs there. So that is why we bought it.
Thank you so much. Commissioners, any questions?
So they have some cool algorithms that can mathematically see when we're getting bombarded with trash.
So
it finds a way to stop it.
So the means of which it actually stops the request is actually it spoofs what it is on the localized network or in the cloud environment and then sends resets based on that. So it essentially neutralizes the network traffic between the host and or the recipient on this end or the two endpoints within our environment. How it calculates all this, it goes off of essentially your pattern of behavior. So it was in our environment analyzing for at least a month period prior to any form of intervention. It just gathers those intervention ideas, and what it builds off of that is a large database of patterns of life. So it knows in the treasurer's office that this machine normally goes to this, and this, and maybe sometimes goes out over here over the web. But wow, this is really unusual. You've never connected to this global endpoint before. There's no reason you should be. We're gonna flag that for review and or once it's in 24-hour remediation, it would prevent the connection in its entirety. So
Jackie, you've never wired money to Somalia before.
I mean, it's also being used. We have it in conjunction with several of the indicating sharing facilities that are provided from Homeland. And so what that's ingesting is elections and county specific. And so MS-ISAC, ES-ISAC specific threat indicators. And so once it's ingesting those, so it's like, oh, you've provided that to us as a known indicator. We're now seeing it there, another remediation step. So it's a large connection, but the largest selling point there is essentially the pattern of life and not stepping out of that pattern. You don't have ransomware on a daily basis, so there's no reason for you to talk there.
Right.
Does that help answer that question?
Sure
Yeah,
does.
very
Perfect.
much so.
I'd entertain a motion for item 19 unless you have any more questions.
I move that we approve item 19 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor, please signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. Motion carries. Thank you for getting that covered by Secretary of State's office or whoever. That is fantastic news. 20, discuss new RFP platform software for usage at Albany County. Adam.
So with the passing of the current engineer and moving into new facilities, the need for an RFP platform has become pretty evident. I know prior to leaving, we were asked to evaluate some different solutions, as to how could the county better process and streamline its RFPs and be more publicly accessible in those regards. Went out and looked at that. Delayed slightly just in due to figuring out what the engineering situation was going to be and how that would align here with Albany County. Coming back full circle now that you guys have an alignment with an engineering representative, so on and so forth. I'd like us to push forward. We did a demo set with the clerk's office as well as the attorney's office on the Quest CDN platform. So this is a fully web-based hosted RFP platform that is used, is probably one of the most utilized, especially in the construction world set. And it's free for us to use. That's part about it. It will provide us the ability to upload bids, addendums, attachments, create our plan holder list, manage it appropriately, send out notifications, and their newest update is supposed to have a full Q&A section, all of which are the huge time-consuming relations that all of your staff deal with. So centralizing that, giving them that efficiency. Really, what I'm just looking for is just to make sure that you're happy that this is the directive that you're looking for, that you're looking to go to online bidding for our RFP platforms, and that you're okay with us continuing forward. At this point, I would just ask that's really what I was bringing discussion here and making sure we're encompassing the vision of the commission in doing so.
Commissioner Barrow or Richardson, do you have any questions, thoughts?
I don't. I have one comment, and that is that when we advertise in the old school way that we advertise, we don't reach the professionals that we want to reach. And so in addition to streamlining and doing all the things you described, this is easier for the business world to find than for us to find the supplier or the contractor or the service provider that we want to find.
In its entirety, I would agree with Commissioner Heber, Commissioner Richardson. I'm sorry.
I like that other way.
The whole clearinghouses subscribe to all of their listings. When publishes are set based on your classifications, it gets pushed to global databases, all of which people pay to be on these notification lists and or receive all those notifications. Quest CDN is used by the city, used repeatedly across the, I want to say, Laramie area. It's nothing new in terms of the contractors. Might be a little push here and there that you guys are adjusting off your old ways, but I think all in all, it'll be a great push forward and to get us not having to manage them so heavily.
And I can always work with free.
It is free. Yep.
That's super exciting. Thank you guys for researching this and getting to a solution so quickly. Perfect. Of course, I think this is a really awesome opportunity, not only to reduce workload, but to reach more people and more organizations to have more competition. Thank you. I'm huge on that. 21, award internet RFP to visionary broadband. Adam, you're still with us.
I am still here. So last meeting set or 2 meetings ago, you allowed us to go up for RFP for new internet services and fiber interconnects for the 4 county buildings. Coming back from that, we received bids from Spectrum as well as Visionary. The RFP internet team met. We scored based on the proposed proposals submitted, and the Visionary service came out ahead. So I'd like to award that in that directive.
Could you tell us who was on that committee so we can thank them?
Sure. It was myself. It was Jennifer Cran, Kayla, Jackie.
Thank you guys. Appreciate it. Commissioners, any questions for Adam?
We only got 2 responses to our RFP.
We would have had a third with a more Lumen CenturyLink, so CenturyLink's new name, but they were looking for a month plus extension on the timeline. And really, those are the only 3 fiber players in town.
Gotcha. So the wireless internet people don't have the fiber connection.
No, not like Vista Beam or anything of those. Yeah,
right.
exactly.
That's what I'm thinking of.
Yep.
You know, those types.
Mm-hmm.
Gotcha. So the RFP sort of excluded them because of
the
lack
nature
of infrastructure or whatever. Our needs and their infrastructure don't match.
Yes, so
Gotcha.
to give you an overview of what we requested, we asked for gig interconnects for all the facilities as well as a gig up down head end connection here. As well as the ability to fail over to the point to point. So adding that redundancy that we already have, utilizing our existing links. And we were asking for a long-term partnership there. So we we're looking for a minimum like 5 to 10 year partnership back. Technically, we only got 2 bids back. Visionary did put 4 options together, and you can review, it's all reviewable there in the packet, 5-year and 10-year agreements based on and where the construction costs were coming from, essentially. But in all of those package sets, they offered up not only to provide these interconnects for us on those services, but provide new point-to-point installations that they would turn over to us for management. So not only would we gain the services, we would gain brand new point-to-point redundancy links, which is just killer in every regard. So the only change that isn't marked in front of you is I did ask for a re-up on equipment in terms of the point-to-point links. I for a brand set of sick glue equipment. It's the primary that they do. They threw this together quickly just using some ubiquity gear. I asked for a more commercial means, something that's going to stand up to the Wyoming, I'm going to say the Wyoming weather in doing so. And they provided that forward. It was a 40, let's see here. It's a $64 a month charge or increase just based on the equipment on the monthly recurring costs in the additional installations. If you look at that pricing breakdown, it lists all that. So it really made no difference in terms of the bid as a whole, just listing that for transparency.
Commissioners, any other questions? Adam, do we need to give you what option with Visionary that we want to see, or should we leave that up to you?
The option that we're proposing forward and asking for your approval on is the 10-year partnership at the option 2 10-year partnership. So I'd say it would be all in all it'd be option 4 from that. That is your best bang for buck cost set. As long as we write the contracting appropriately, you auto renew in 5 years at 10 gigs for all links as well as the up down, which is, future proofing in a means that I can't express. That really sets you up to succeed for the coming future. We have Patrick Croft on the line as well as Greg here. If there's any other additional resources you'd like to talk to them in those manners. Any questions you have for them, we have visionary representation here. So,
well, thank you all for being here. Any questions, commissioners?
I don't have it. I like it.
Yeah, I do too. Tracy and Jackie, maybe I have a question for you. The money, could this fit under ARPA funding?
Yes, the plan set is that it will be coming entirely from ARPA.
Super.
We've met and gone over the guidelines. The project meets it in full fold. So
you bet.
That is the plan.
Right. Yeah. Hopefully that'll come through, but we do have ARPA. Yeah. Super. And this will be one of those things we put on our work session, right? Commissioners, any questions? I'd entertain a motion for item 21.
I move that we award internet RFP to Visionary Broadband.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye.
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 Aye. All those opposed, same sign. Motion carries. Thank you, Adam, for the work. Thanks, everybody, for helping us out. Visionary, thank you guys for being so diligent and so 4 options, super helpful to us. And Adam, thanks for your vision on this. I look forward to the movies we'll be able to stream.
All the extra space.
Yeah,
all right. No, it's public access, improving public access.
You bet.
And we are planning, I did forget to mention as a part of this project, to increase public access at all the facilities. So you don't even just have to be essentially external access points on any of these remote facilities so that the public can come and incorporate without having to enter the facility. And this is more of the COVID era base.
Yeah.
So just something to add there.
Yeah, and those new digital land office will scream if you come in, right? That baby will load. So awesome. 22, acknowledge receipt of the 90-day notice of cancellation for the contract dated June 28, 2021 between Albany County and 7220 Commercial Cleaning. Jennifer.
So 7220 commercial cleaning cleans both our,
Thank you.
the annex over here and David's building. Oh, the David's building and 501 across the street. And they have a substantial health issue that has recently come up, and we received from Thyra Page the 90-day notice of cancellation. So Roy has reached out to, we have a bid from Wilkin Enterprises from when they bid on the cleaning RFP as a whole. And he's also reached out to the other bidder who's currently cleaning public health to see if they were interested, so that we can try and get somebody else in there to do those things. For the 501 building across the street, IT has offered in this interim period that they can clean that. So while we're trying to find somebody to fill in the gaps, we won't have as much that we have to pay somebody to clean. Because IT said, you know, give us a vacuum. We're happy to run a vacuum and take out our own trash.
Yeah.
So that's what this is. We just wanted it on your agenda to acknowledge and accept it so we can move forward trying to find somebody else. And Roy has reached out to Thyra Page, and I'm not certain what the answer is yet, if they're going to be able to continue for that 90 days, or if their preference, given their circumstances, is that we get somebody in as soon as possible. So with any luck, we'll have in front of you at your next meeting a contract with someone to pick up the cleaning at the other office.
Thank you, Jennifer. Commissioners, any questions? I'd entertain a motion for item 22.
Mr. Chairman, I move that we approve, that we acknowledge receipt of the 90-day notice of cancellation from the 7220 commercial cleaning.
Acknowledge and accept the cancellation, the 90-day notice.
Yeah.
Second.
Somehow these terms, man, I tell you what.
It's been moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all opposed, same sign. That motion carries. Our sympathies to the Page family, and thank them for giving us heads up, and hope that things turn around someday. So item 23, make appointment to the Urban Systems Advisory Committee. And let me see who's on that one. The commissioners, anybody have any? I know County Attorney Britsius has this passion for urban systems advisory committees, but I'm not sure. I think we had a couple of names that we were going to figure on, and then there has been one that has been accepted, or no? David left so soon.
My understanding from David at our pre-agenda meeting was that Jory in his office was happy to serve on that committee. David spoke with Karen Bowman, and her preference was to not. So
Okay.
Jory said he was happy to do it, so that, Kurt wouldn't have to.
Right. There were crocodile's tears when Jory were from the county attorney's office, I'll tell you. I entertain a motion for item 23 if nobody has a question.
I have no questions.
Okay, how about a motion for 23?
I move that we appoint Jory.
He's got a last name that's hard to pronounce.
I don't know how to say it.
Jory from planning office.
Right. Got a lot of confidence. It's moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye.
Aye.
Aye, all those opposed, same sign. That motion carries.
If I had a cool name like that, I would love to have a public meeting. The commissioners couldn't say my name.
Somehow, I probably should be able to get somebody in here. So Jody is right on track. Hey, Adam, could you let Jody in for us, please? Because she's right up next. Thank you. And I'm not sure I see let somebody in from the waiting room button here.
There is not. That's not a quick action there.
Dang it.
One of the short ones. I know.
I was going to use it to prove that I could do this. So item 24 is present for approval, resolution 2021-025, supporting COVID-19 vaccination efforts by authorizing contributions up to $25,000 from Albany County funds for the provision of vaccination incentives. Jody, good evening. The floor is yours. Can you hear us? She's still connecting. So just to give a little background, group of community members got together and have organized a vaccine incentive program to help people move towards the goal of 70% vaccination in our county. All volunteers, unbelievably diverse set of people. Jody, of course, everybody knows Jody from the rec center, and a former mayor, to Mandy Gifford at the president's office, Trey Sherwood at Main Street, Father Rob Spalding, and the list goes on and on. And so, Jody, the floor is yours. Welcome.
Can you hear me?
Gotcha. Loud and clear.
Excellent. And if they're not already on, they will be shortly. Mandy Gifford and Rob Spalding, Father Rob Spalding, are going to be joining as well. We just wanted to share with you a little bit of information about what we're doing. Overall, this started as a resolution that was going before the city council authorizing the use of up to $25,000 in support of achieving a goal of 70% vaccination rate in the county. And we want to thank you for joining in potentially, we hope. Father Rob's having a hard time getting in. I'll take a minute here and forward him the link as well. I'm not sure exactly what happened, but somehow we didn't quite get everybody. Let's see.
Mandy, we're just waiting for Father Rob to join us up.
Actually, Mandy, could you forward him the link?
Absolutely.
That'd be awesome. Thank you. So anyway, I want to thank you for joining in and considering the authorization of use of funds. This project really started, honestly, kind of on the heels of having the vaccine clinics kind of reach a natural ebb, I should say. Mandy was part of the group that stood up the vaccine clinics, and I had been asking, how can we help? How can we help? Because when we started at the recreation center back up from our initial closure back in May, we had spent two good full months trying to figure out what we were going to do to be able to provide a safe environment for our patrons and also our staff. And for two reasons. One, obviously we want to protect the health of the people that we're bringing into the rec center to be healthy, but also we need a staff to be able to serve them. And we quickly ran into some challenges. We had researched best practices to limit the spread of the virus and quickly adopted those. That was moderately successful, but as with most things, sometimes change is challenging, and people were, I think, not entirely certain that some of the best practices would actually work. And we had a number of outbreaks that caused closures, somewhat limited at the time, pool closures, in addition to that initial closure. And we've had over time real challenges keeping ourselves staffed. That continues, but for different reasons at this point. So when Mandy reached out to see if we would be interested to put together an effort to create an incentive plan, of course, I jumped on that, and it initially started that way. But I think what we've all realized is that what started as an incentive project, like we were seeing in many other states, where you offer to allow people into a raffle for getting their vaccine, or some small stipend to offset maybe the time off of work, or childcare that they might need to go to the doctor, quickly became a bigger project, because we realized at the end of this initial incentive plan, the pandemic's not going to be over. The impacts of the pandemic aren't going to be over. And so we fully recognize that we have more work to do than just the incentive plan. But initially, that's what our funding is going towards. And here in a little bit, I'll describe exactly what all we're doing with that. But I did want to say thank you to you all for considering this and considering supporting it. One thing we are finding is that the people who are currently unvaccinated and being impacted by this, in a lot of instances, there's obviously a philosophical, a group of people who are philosophically opposed to the vaccine for a variety of reasons. And we acknowledge that. But there are also, as we're learning, a group of people who maybe haven't been able to get the vaccine, even in our county. And I think we feel like that because it's hard to believe that even in our county, those who might be fine with having it just haven't been able to. And it happens for a variety of reasons. There's a lot of people who just really aren't plugged into the information that's going on. If they're limited in terms of their exposure to people who've been sick, or the impacts of the virus for whatever reason, they may not feel there's much of a sense of urgency. I have a child that falls into this category. I think there are people who don't have a physician. Young people, oftentimes young adults especially, they don't go to the doctor unless they're sick, and they have to be really sick to go to the doctor. So they may not have a physician that they can go to and ask advice or information about the vaccine. They may not know where to go get it. They may not have transportation. We are finding a demographic that is lower income nationwide. It has not been able to access it. And typically what we're hearing from the information that's coming in, the reasons that are being given are, if I get the vaccine and I have to be out of work because I don't feel well, there's nothing that will cover my wages. I don't have anybody to watch my child while I go get the vaccine. And then what if I'm sick and I can't watch my child? There's a lot of hesitation because of those types of items. So what we're trying to do through sorry about my dogs. What we're trying to do is address a multitude of things through this vaccine project. The first of which is incentivizing people and getting the information into the hands of people who might be willing to consider getting the vaccine. And so let me turn this over now to Mandy. We're a little backwards because we were struggling to get on. Did Father Rob get on?
Yep.
Yeah, I made it.
Awesome. Okay, so Mandy, I'll turn it over to you.
Thank you, Jody. Thank you, Chairman Gosar and Commissioners, for having us this evening. I'll provide a little bit of historical context. Am I unmuted?
Yeah, sorry, we did that. Sorry, Mandy.
That's okay. Thank you so much. Thank you, Jody and Chairman Gosar and Commissioners for having us this evening. My name is Mandy Gifford. I am the Administrative Associate in the Office of the President at the University of Wyoming. I will give just a brief history on collaborative efforts that we've seen through this pandemic in our community, and that led to this coalition that's helping lead this effort in our county. I've been involved with UW's COVID response since last March. And when the vaccine became a reality late last fall, back in November, December, we reached out to Albany County Public Health and Dr. Elias just to engage in conversations about availability and understanding how are we going to get it to our campus and our community, as well as offer our support and resources to the county. So from those conversations, strong partnerships developed between the county, public health, and Ivinson Memorial Hospital and UW. And together we coordinated the first large clinics in Albany County. We stood up a COVID hotline, and all of us really worked tirelessly to implement the Wyoming Department of Health's vaccination plan. So in the spring of 2021, as the vaccine was really available to anyone who wanted it, we moved through those phases of the Wyoming Department of Health's plan fairly quickly. We really wanted to understand on our campus what our vaccination population was. So we have made it mandatory that employees and students report their vaccination status. And we weren't at a very good percentage that we liked. So we decided to take action. And we launched an employee vaccination incentive program, which kicked off in April. And we have seen an increase in full-time benefited employees from 55 to 73%. So we saw immediate results in offering incentives, which was fantastic. Our next focus was on our student population, and that campaign kicked off on July 9th. And we've already seen weekly 5% or more increases of students reporting their vaccination status. And in the first 3.5 weeks of our program, we had over 1,000 students report their status. So we have felt successful in incentive programs. So in June, Dr. Elias reached out to talk to us about our incentive programs and how we're handling it. And we then discussed organizing the Albany County Vaccine Incentive Working Group, this vaccine project team, and representatives that you have on the call today. Our first meeting was on June 30th, and we have met twice weekly, sometimes more. We have subgroups that are working on the incentives themselves, organizing contributions to that, and laying out the plan for distribution. We have a marketing subgroup. So it's been a busy couple of months for us. So with that, I will turn it back to Jody or Rob, maybe, Father Rob.
I'm happy to jump in. Thank you, Commissioner Gosar and other commissioners gathered here. Jody already alluded to, I think there's no naivete that we just think by putting some money forward, suddenly everything is going to solve itself. Not at all. But this is a definitely long-term campaign. And one of the things we've talked quite a bit about is how people might respond to the use of tax dollars for incentive program. We are convinced that the economic output of the money that we're asking for tonight actually is a net savings for the county and for the people of Laramie. But even more so, beyond the initial incentives, committed to reaching out to underserved populations, especially those that may have linguistic differences. We've talked about locations for vaccine clinics, how to combat the spread of disinformation. And I think that's probably where my passion is, of those communities that haven't been received or reached yet, and how do we continue to reach out? So I just wanted to offer those comments to say we're not finishing in October by any stretch of the imagination, but see this as a very long-term effort and a much needed campaign. We were just with the city council, and sadly, the current status of COVID in our state and in our county actually make an opportune time for a vaccine initiative. As cases continue to rise, I think there's an increased motivation for people to say, what can I do to protect myself and to protect one another? The marketing, the messaging that we were providing has nothing to do with trying to shame or trying to make someone feel bad for not getting the vaccine. Quite the opposite. It is an invitation and an opportunity to participate in community life and caring for one another. So I will reserve the rest of my comments and make myself available for questions at the end of our meeting tonight. Thank you.
Commissioner Gosar, a couple of other things I wanted to share with the commission. Yes, I got myself off mute. Sorry, double checking. I'm sorry that I didn't send you the graphics for this, but I will direct you. We have a website that is in progress, but I have a couple of pieces of information that I think you'd find interesting if you want to look at it. It is hosted on a city webpage. It's cityoflaramie.org/vaccine project, and that's all one word. And if you go there, you'll see two pieces of information initially. One is an icon that says COVID vaccine rewards, and it says click here. And it lists a couple of things that are kind of the core of our incentive program that we have stood up at the moment. This launches really this week. We are in the process of providing information to all of the providers in the county, along with $25 gift certificates that have been made available through the funding that we've collected, and also funding that's coming from the state for the Albany County Health. It's through a grant for this purpose. So there'll be $25 gift certificates that are available when people go in to get their first shot. So they have to get their shot. And the intent of this gift certificate is to provide an offset for people maybe who have to take a couple hours off work, or need childcare or something of that nature. It may just be enough incentive that, hey, $25, actually, we did some research on it, and $25. When I say we, it's our wider we. It's somebody from the university has done some research about what threshold is required for something to be inducing for changing behaviors. So $25 is proving to be a reasonable threshold for people. I'll get $25, sure, why not? So those are being provided through some of these funds. Then secondly, the thing that you'll find if you click on that link is a registration form for our raffles. We are going to be having $1,000 raffles for 5 weeks, beginning on September 6th. We'll have them each Monday. And when people sign up for that raffle, they can sign up at any time. You could sign up if you haven't had one shot, although the clock is ticking because you have to be fully vaccinated if you win a prize. So we'll do drawings each Monday. People will have 1 week to come and redeem their prize. And so what that does is it gives people a little bit of an opportunity. If they haven't, gotten around to getting their second shot, they can go get it, come in, get their prize. And those people potentially who might get drawn who aren't fully vaccinated can be re-entered into the drawing, and hopefully, their odds will be good again. But we'll have 5 $1,000 weekly drawings. Then the 6th week, we will have a $2,500 cash drawing, as well as grand prize drawings that are going to be including a variety of gift packages that are provided by our local business community. And so this is going to be running beginning August 30th through October 11th. We plan to have the website up and running sometime next week so that people can go ahead and register for the drawings. And we are attempting to get our gift certificates out this week to the local providers. So people who are interested in getting a shot, they'll know that there's a little bit of additional support to do that. The other thing that we've done is, sorry about that, 2 corgis. It's like an alert system in my house. We are working with United Way and also with the 211 system. And so people who may be in need of more significant resources, for whatever reason regarding getting their COVID vaccination, there's a number of people who are really worried about taking time off work, or what if they get sick because of the vaccine and have to have additional time off of work. Because, like my son, he works 6 days a week, not 5 days a week. He doesn't have 2 days off. So it can provide a stipend. It could provide transportation. It could provide daycare services. The United Way already had a system set up that we will be providing some funds into. They'll be using that same system for COVID relief that they've had in the past. People can find out what resources are available by calling 211 and telling them where they are and what they need. And that's how we intend to connect people. So one of the things I want to reinforce is this collaboration is probably one of the most powerful things I've seen. It's a group that is very skilled and interested in helping our community get past this pandemic and to a place where we're done with the after effects of, staff shortages and illness. And it's a lot like building the plane as you're kind of in flight. It really does feel that way. So if you go to the website today, it won't look that way tomorrow or the next day, because we will be continuing to add to it in terms of the resources. Let's see. We also anticipate that once we're done with this, if you're doing the math and seeing what funding we may have available, that the initial group of funding has been used for $25 gift certificates, and then also the cash drawings. We also anticipate that there may be additional projects that we want to fund after we get done with this initial thing and are able to assess like what's been our effectiveness, how far have we come, what needs are still needing to be met. But our real goal here is to help people, not to force people. So I hope that provides kind of an overview of what we're doing right now. And then as we move further along, I'm sure we'll be able to come back. One other thing I wanted to mention is that our group has decided that it's important for not just the city to be providing funding and the county to be providing funding, but also that we reach deeper into the community to some of our large organizations who might be willing to offer the support, not just of staff and resources that way, but also funding as well. And so we'll be making additional presentations out into the community. The university has been great to work with in terms of not only support, but also providing funding that they're incentivizing their students and staff with. So that's all really encouraging. And with that, I'll turn it over to Mandy.
Thank you, Jody. Chairman Gosar, commissioners, as you just heard, we're really trying to reach far and wide to address the barriers that some of our residents might have in getting the vaccine, such as missing work, childcare needs, food security, and other situations. Our communication and marketing plan is also very comprehensive in those efforts. The You Call the Shots community vaccination effort marketing campaign will hopefully kick off at the end of this week, if not by the beginning of next week. Within that, we are targeting multiple outlets to get the word out about the vaccine project, including social media, digital ads through Town Square, posters for downtown that include a QR code. So folks just snap a picture with their phone and it takes them right to this registration link to sign up for the vaccine project. Social graphics, and video ad that we're hoping to put in the local movie theaters, not to mention the website that Jody has directed you to that has the full details with the registration link for the vaccine incentives. Like we've mentioned the whole time, this is such a collaborative effort between so many groups, and our social media and campaign and marketing campaign will use everyone that's available in this collaborative effort. So Ivinson Memorial Hospital has been really involved and leading the way with our marketing campaign and communications and developing the graphics and the language used and the timeline for launching some of these. And we also have partners at Downtown and Main Street Alliance, Downtown Clinic, City of Laramie, Public Health, and UW that will just be mimicking social media posts and really spreading the word far and wide. So we can't stress enough the collaborative effort that we're having with everyone involved in this. And like Jody said, it's just been a grassroots effort with all of us and trying to learn as we go and address as many concerns as we can. And everyone has really put in the effort and done a lot of time in organizing and putting this vaccine project together. So thank you.
Commissioner Gosar, just to wrap up a couple of things. One thing that I wanted to mention is when we started on this project, I think we all came to the table, all of the different entities that came in with different ideas of what we were going to do with that project. And we spent the first couple meetings trying to figure out what we were doing. Because some people thought, well, what we need to be doing is we need to be doing mobile or pop-up vaccine clinics. Some people thought, well, what we really need to be doing is marketing to get people to the providers that are providing the vaccines. Some of us thought, well, what we need to be doing is incentives to provide, resources that people might find compelling enough to go and get a shot. And what I think we realized is that it's going to be all that, and it's not one thing. And the more partners we have brought into the mix, the more thoughts we've had, resources that have been added, skill sets, ideas. The school district has been involved. Father Rob didn't mention, but one of the things we're committed to doing is making sure that we aren't missing out on our Latino speaking, our Spanish speaking populations in the community, to make sure that we have the appropriate people to communicate, whatever concerns that they need to have addressed. That at the school district, whenever they're hosting family nights, if there's an opportunity and we have the resources, that we bring those to bear. The group of people that started this with the vaccine project has worked tirelessly. And I will tell you, the thing that is so challenging about this right now is, as we're seeing a surge, the people who have been working at it and thought we were getting close to the finish line are worn out. And so I'm heartened by the group of people that have come together to pitch in their effort now, that maybe have a new energy, they have a new approach, they have new ideas. And so we're not doing the same things we were doing before. And I think that's really what's going to get us to the point where we're past the pandemic. Right now, I'll tell you what we're seeing. Initially, we had people who were quarantined, people who were out of work because they were sick. Now we're having that, but we're also having, just real stress disordered people in the workplace, people who are resigning, people who are retiring, people who are choosing not to work as much. And that's really affecting our ability to provide services. I know at the recreation center, we are going into a 2-week closure of the pools entirely, because I don't have enough staff that aren't burnt out to run the pools. And that says something, because we normally run about 35 lifeguards, and we were getting down to where we thought we were going to have 2. And, you know, we can't let our community energy diminish to that level. We have to do something. As I like to say, no one person can do everything, but every one person can do something. And so if each one of us can offer some skill set or some effort, we are committed to doing so and seeing what we can do to get our community past the pandemic. Father Rob, anything else to add?
I'll just offer for any questions you might have.
Thank you, guys. I sure do appreciate it. Commissioners, any questions for the group?
I don't have any questions. I just want to say thank you so much for this extensive and phenomenal effort that you have put forth, your whole group. This community is just so lucky to have so many people involved and trying to make a change in a situation that is just dire, quite honestly. So thank you for improving the situation, not just for Laramie, but Albany County, community or countywide. So thank you to everybody, and please extend our thanks to the entire group and everybody involved.
Will do.
Commissioner Richardson, anything? Well, guys, thank you. It's great to see you. I do have to tell that at one point we had an interesting incentive that I was really impressed with. Father Rob thought that maybe he could get somebody a pass to purgatory. And I thought that was really useful. And I'm not going to tell you why and who it would be useful for. You know, you can't get heaven, you know, that's the next best step. So thank you, guys. It has been bi-weekly meetings. It has been small groups, bi-weekly meetings. So these people that are in front of you today, Mandy hasn't left her office, looks like. And some of these folks have been meeting around the clock, trying to do interesting work and trying to help people without vilifying, to say, how can we get you there? Is childcare, that issue that stumbles you along the way, is non-benefited positions being that roadblock, and trying to find solutions. And so we really look forward to seeing how this rolls out and being part of it. I think I know how I'll vote on this. And so commissioners, any other questions? No. Awesome. I'd entertain a motion for item 24, please.
Mr. Chair, I move that we approve resolution 2021-025, supporting the COVID-19 vaccination efforts by authorizing contributions up to $25,000 from Albany County funds.
Second. It's been moved and seconded. Any further discussion? And just before we vote, Tracy and Jackie, is this one of those things that we might be able to use ARPA funding for? You're right. That's all right. Yeah. Well, we'll find it one way or the other, I'm sure. Jackie, do you have something to add to that?
Mr. Chairman, what I would suggest that if you allow Tracy and I to look at the possibility of using ARPA funds, otherwise appropriating from funds from 1% miscellaneous uncommitted.
Okay. Okay. Do you need us to put that in the motion at all? Or just that direction?
Just that direction.
Okay. Okay. It's been moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye. Aye. All those opposed, same sign. That motion carries. Thank you, guys. Thank you for your time tonight. Thank you for your work. And let's get this thing to 70%. I'm really excited.
Thank you for your consideration.
You bet.
Thank you.
Item 25, acknowledge receipt and accept amendments to the petition to vacate a portion of 3rd Street in Albany County, Wyoming, located in Centennial Plat. Commissioners.
If
Jennifer,
you don't
please.
mind, Chairman Gosar, I just thought I'd give you an update. This is the Larry Lang petition that was filed last fall that we recently amended to appoint Karen Bowman as the new viewer. Mr. Lang reached out to let us know that one of the original property owners that he had included in his petition as part of the requirements had moved. So he wanted to update that petition. So as it's being looked at now, there's a new property owner and everything from his end is in compliance to the way with the regulations. So we just wanted to have this on here for your acknowledgement and acceptance that it's been received.
Okay. Commissioners, any questions, concerns? I entertain a motion for item 25.
Mr. Chairman, I move that we approve item 25 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 26, present for approval, the request for qualifications, Cast Rock for Protection Plan update. Commissioners and maybe Commissioner Ibarra.
Yeah, this RFQ just follows the MOU between the city and the county to work toward establishing a consolidated cap between the two government entities, and the city and county staff. I developed the RFQ and just need to have it approved to move forward.
Okay. Any questions? Thoughts, concern? I'd entertain a motion for item 26.
I move that we approve item 26 as presented.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye.
Aye, all those opposed, same sign. That motion carries. Item 27, present for discussion an update regarding the county's payment to IMH for Title 25 for fiscal year 2021, additional amounts owed for fiscal 21-22, and revisions to the contract with Ivanson Memorial Hospital for Title 25 payments. Could you give us a little background about Title 25, please, Jennifer?
Yes, so Title 25 is the emergency detention statutes. And as part of those statutes, the county is required to pay for the first 3 days of any county resident who's emergency detained at the hospital. And it's 3 days plus Saturday, Sunday, or holidays. So it can be up to a total of 5 days, I believe. After that, the state picks up the rest of that tab if they're not covered by insurance. So what happens is the county is the payer of last resort. They try and bill, the hospital tries to bill insurance first, does all of those things. And then when it comes down to the people who are uninsured or who their insurance doesn't pay, then it falls back to the county. We've had contracts with Ivanson for years. Last year, we had our general cap with the hospital in our contract is for $175,000 a year. However, in fiscal year 2020, 2021, the county paid a total of $281,840. And what that is, after doing research and talking to the clerk's office and to Deanna Allen at the hospital and sitting down in meetings, is there was a period of time where the billing was occurring on a semi-annual basis, and then it was switched to a monthly basis. And then at some point in the 2018, 2019 fiscal year and the 2019, 2020 fiscal year, bills either weren't received by the county to be paid or were received and didn't get processed in a timely manner. I'm not certain. So what happened was, for what we can tell, in going back and trying to reconstruct all these things, is that there was a discussion between Peg Trent and the hospital saying, we need to catch up this billing, because even for some of the billing we were getting, it was for 18 months or more prior for dates of service. And so, and that's kind of how it had gone on. And there was some discussion about catching it up. There was never a contract amendment signed. So the first spreadsheet, I think that you have, it looks like this on the first page, or it's in your materials, I think. I went through the payments that I got from Amanda, which is what this spreadsheet is. And then I went back and reallocated them to the fiscal year of the dates of service that were provided. And if you look at the very right-hand column of that, there's a column that says total payments allocated to fiscal year. And what I was trying to do there was to make sure that even though in this last fiscal year, we paid all of that excess amount over the contract amount, there wasn't any fiscal year where we paid more than what the cap on the contract was for services during that fiscal year, because the language in the contract our argument was, it's $175,000 a year. We shouldn't pay you more than that. And the language in the contract says fiscal year, and they're like, well, that was for dates of service, but the contract was unclear. So we're fixing it. Well, they fixed it last year. I mean, Peg worked with them, fixed it last year. So none of the current cap on the contract is the contract, we don't have a new one. There's a draft one in here. But the prior cap has been $175,000. And the most that we paid in any fiscal year since the 2016-17 fiscal year was $168,000 in a year for a dates of service fiscal year. So moving forward, in general, we should not have issues with our cap. We had a meeting with the hospital, I think last week, and they confirmed that there is no more outstanding large amounts of billing. There's always 3 or 4 accounts where they're working with insurance and it takes a lot longer to get it caught up, but it's not years worth of back billing that hasn't happened. So I know this was a discussion during the budget session at some point, and I know that the budget for this next year was increased to account for this wash that we have, or not wash, but these months that we had where we received, if you look at your second page that looks like this one, these are the bills that we have unpaid as of currently. We received the invoice in May of 2021 for $25,646. That would technically apply to last fiscal year. This revised contract that was also in your packet, we adjusted the language in that contract to say, going forward, with the exception of this payment or this invoice received in May of 2021 that we haven't yet paid because we wanted some direction from you before we move forward. Going forward with that exception, we're not going to exceed $175,000 in a year, and we will be billed for services that are occurring within a reasonable time frame from when we receive an invoice from them. And the hospital has said they can make those assurances once we resolve this invoice that was received in May of 2021. So I just we'll bring you, once we work out all the details with the hospital, we'll bring you a final contract to look at, but I wanted to give you some background and see if you have any comments, questions, or concerns. What I would like to do, because Jackie, we had these discussions before the end of the last fiscal year budget, so she increased the line item of the budget for Title 25 for this current fiscal year to account for this $25,646 that was billed in May. So what I'd like to do is, with your approval, and once we get the contract finalized, pay all of this that's owed and have some assurance then, or the commissioners can have some assurance then that going forward, we should not be exceeding that cap of $175,000.
Thank you, Jennifer. Commissioners, any questions?
And Jennifer, that's going forward from August.
It will actually go back to, so it'll be on the fiscal year. So it'll be July 1, except for the calculation of the billing, it's going to be through, we're going to back up the billing a month. So it'll be anything received after June 5th will count as the next fiscal year. So that we can, whatever comes in that next 12-month period, going forward, we only have a 12-month period, and it will come in prior to the end of the fiscal year so we can get it billed and get that line item closed out, and we don't deal with this rolling forward where we have something that's an odd month that's hanging out there.
So that's an internal thing that we would do. We would basically make a cutoff on June 5th, and things that come in after that would roll into the next fiscal year.
Yes, and I wrote it into the language of the contract so everybody's on the same page.
And Ivinson, I think, decided that they wanted to help us move that billing so that we got more of it by June 5th, right?
Yes, and so in the meeting that we had, they said that was fine with them going forward and that it all makes sense and this clears it up, the past issues, and that once if it's okay with you as a commission that we pay that May of 2021 bill for the services from April of 2021 in this year, we shouldn't have an issue going forward.
I have one more question.
Sure, you bet.
Yeah.
Maybe it'll turn into two. So the look back was, are we going back 4 years? How far was the look back?
So the payments that we paid in 2021, in the 2020-2021 year, applied $161,245 was applied to the 2019-2020 fiscal year. $51,490 was applied to the 18-19 fiscal year. And that's those. The prior year, so in all reality, the only amount that we paid during fiscal year, the last fiscal year that was applicable to that fiscal year was $69,105 of the $281,840.
So the extension of my question was going to be, if you have a 4-year look back of $175,000, that's $700,000. So it would be interesting to see. I mean, because if we don't spend the line item, we essentially carry that forward into the next budget year. So from my perspective, here we are trying to sort it all out. The only thing that would bother me as a commissioner, like if they didn't get us billed in the fiscal year, it doesn't bother me. The question is, do our total payments over 4 years add up to more than $700,000? And if it did, then I was annoyed.
No, they don't. In the years where the cap was $150,000, which was only the first year of 2016 to 17, the total the cap was 150 and we paid 147,862. In the 17-18 fiscal year, the cap bumped up to 175, and in total allocable that fiscal year is $144,431.24. And for the fiscal year 2019, like 18-19, it's in the spreadsheet too. We paid $168,370.64. And then for the 2019-2020 fiscal year, we paid $161,245. And all of that was paid in the 2020-2021 fiscal year.
Gotcha.
So in no year did we exceed the cap, but now the back billing has been caught up. So we won't have that issue going forward.
I'm sorry, I should have been better prepared for this. To my knowledge, and I'd have to look at the exact figures, but I believe in this last fiscal year, of 2020, 2021, we paid over $200,000, and like you said,
we paid $281,840.
Okay, and so, and we only budgeted the $175,000 that was the initial contract. And so this current fiscal year, not knowing how much our contract is going to be, because we did not have a contract in place prior to the expiration of that contract, we budgeted $150,000. So I believe adding the $25,000 shortage plus the $25,000 that's due for the May billing, we have to come up with an additional $50,000 so that we don't overexpend that line item in the budget. Am I calculating this correctly?
How much is in the line item budget for the 2021-2022 fiscal year?
$150,000.
So it would need, so the budget cap that's in the contract is 175. And the additional potential amount is the 25,646. That's the most. So it would have to be $200,646 at the most. if it's a year where we don't have as many billings, it's possible we would not expend every bit of that. Does that make sense?
Yeah, but I think you have to budget as if you would.
I
Yeah.
agree. I'm sorry. I thought, well, I'm sorry, Jackie, I didn't understand when we talked
That's
earlier.
okay. I just for the paper trail and for knowing that we will need to appropriate at the most an additional $50,646 that I earmark those funds because we're into 2 full months of our budget and we've expended a lot of funds that I'm concerned about. I really am, frankly, because we weren't anticipating these additional expenses. And so in light of what's transacted in the last 2 months, I think I need time to work with Tracy to make sure that everything is documented and that we properly allocate funds from areas that we know the funds are available. And that might mean tapping into our emergency reserve. And that's without any discussion with Tracy. I just want to bring it to your attention because I think so that we're all on the same page and we understand. I don't want to be misleading and saying we've got the money to cover it. I want to make sure we've got that money to cover it.
Yeah. I'm not sure I got my question answered, and that was, so the first year in a 4-year look back is 150, followed by 3 at 175. So to me, that's 675. It seems like what we're catching up on is more than the difference of being underneath the contracted amount. You know what I'm saying? So I don't really want to pay more than 675 over 4 years.
Can I show
When
you
they
my-
can't figure out, you know what I'm saying? But I was trying to do mental math.
I can't do math in my head. That's what I'm going to show you on my.
As you were spitting out what we paid each year, I was trying to figure out if it added up to more than 675.
So this is what was paid during the year. This is any catch up during this fiscal year. This is any catch up during that fiscal year. And then this is the total allocated to the fiscal year. So this was the 150 cap. This was the 175 cap.
Right, so here we're at like, we got $2,200 under. This one 175, so this is 40 grand under, no, 30 grand under. 31. Yeah, we'll just approximate.
This one's the 175.
So that's 7,
This is 175.
and that's 9, let's say. So if we,
And this is 175. This is the year.
well, that
end.
one would be the one that makes up for it.
That's this. This is the year end that ended in June of 2021.
Right.
So
So-
that's where.
So here we are, what is that, 100, is that a 69? So we'll call that 106, okay? So 106 plus 16 plus 31.
Hold on, I'll pull the calculator. 106 plus 16 plus 31. Is that what you're telling me? Is 153.
So that means we're 153 below 675.
Yeah,
Right.
they're right in the 5. 1, 2, 3, 4, 5.
So that would make it
5 at
4 at 175 and 1 at 150. So what is that, 750? No, it's 850. Yeah. So we're about.
Mr. Chairman,
Yeah.
I'm
Anyway.
sorry. No. And I appreciate that I have backup here because obviously I was looking at 2020, fiscal year 2020, 2021 and not looking at 2021, 2022. We have budgeted $250,000 in that line item for IMH. And so thank you. I apologize for that. I am glad because we spent $281,840. I think in our discussion, we thought we better be safe to go higher than to go lower. And so I apologize for the misinformation of needing an additional $50,686.
Makes me feel better because I thought my understanding from our first conversation was that it had already been budgeted, but I don't know budget and that's why I asked those questions. No, it's okay.
So I added it up. Over the 5 years, we came in 155 below the contract amount. So if currently we're going to go more than 155, then I would be annoyed.
No. So, and really, if we're budgeted at 250,000, we should not exceed $200,646 at IMH. So.
Well, I got to say thank you for catching it all back up and moving it into something we can budget and expect. And so thank you guys for wading into that morass. I remember I was listening in and oh boy. Yeah, and thank you for budgeting us at 250, whoever was responsible. I think probably you, Tracy, and you, Jackie, and Kayla, and whoever.
I think we talked about it, and I do apologize.
No,
for
it's
that.
okay.
No, I just, when we talked about those numbers, and I have to tell you, because we have already, we're getting close to spending a lot of funds that have not been committed so far, that I'm in a panic mode that I don't ever want to put us in a position where our appropriations are more than what our revenues are. So I apologize.
That's okay.
Thank you.
No, thank you. I
And
appreciate the
your total
clarification.
was about 155?
Yeah, so
Okay.
the point is we came under by 155, and so if our budget is 250, then we're still 75 ahead. Right?
Exactly.
And
on the average, we only use half of that, so it all works out.
really, we only use 25,000 of that. This 25,646, because that's the only carry forward from last year.
Gotcha.
So that takes us like to 130.
So it was a lot cleaner than we thought.
Yeah.
It was super confusing for a little while, but with a lot of teamwork, we sorted it out.
Yeah, and so look forward to that.
Yes.
And thank you guys. And I know Sheriff Applehands was in on the conversation, and I appreciate those thoughts. And then with regard to the budget, I think when you and I and Tracy sit down, I think there are some funds that might be applicable to ARPA, as I understand it, that might not come out of our general budget. For instance, water caps and that type of stuff. I think those would be applicable to the ARPA, but we'll let what you guys know about it help inform that. So awesome. That leads us right into item 28. Set the work session to discuss ARPA funds. And so that has to be before August 31st because we have to have a report about how we're going to spread those ARPA funds. And I think next week we had 5, we're down to 3.
Tuesday and Wednesday.
Tuesday and Wednesday. Commissioners, how does your Monday look? Or would you like to do it the second half of Wednesday? Do you think we would have time on the second half of Wednesday?
Yes, I'd go for the second half of Wednesday.
I would love the second half of Wednesday.
Okay, how about you guys? Would that work? Yay. Okay, so let's do that. Second half of Wednesday. And
Do
if you
you
could,
need a motion to set the work session? I don't know.
I don't believe we do.
I don't think so either.
Yeah. And if you could maybe send out a note, Jackie or Kayla or Tracy, or maybe I can do it, to program heads and electeds to say, hey, this is being discussed and thought about. Would you come with your ideas? And that way we might be able to move that conversation along, especially if people will email those ideas to us previously, and we can try to fit them under the categories that they might fit under.
Speaking of that, I've had inquiries from the fire district and also the library has inquired if they would be able to tap into any of our funds. So do you want us to reach out to them as well?
Sure. Why not?
And anybody else who didn't do it themselves.
Yeah. And then Tracy, my question is this report for the amount that we have received, or is this for the entire amount that we are to receive? So double that.
I have not read the entire document yet. The
Bailey.
recording.
Entire amount. Okay. So, okay. Yay. Thank you.
So we're documenting what we've already done, planning what we intend
You
to
read
do.
the whole recording?
Yeah.
So we're going Wednesday, the 25th at 1 p.m.
Yeah, whatever, where we ended. Yep.
That one?
We need a hard stop or a hard
Okay.
start.
If you do, that hand hearing is at 8:30,
Okay.
but then I mean, 2 hours probably tops. So if you set it at 1, that gives you time to go eat lunch or catch up on emails or calls or whatever you need to do.
Okay.
Sounds good.
1 o'clock on the 25th.
Mr. Chairman, if
Sure.
your request to have department heads or elected officials or other entities submit any information, could we, and I'm happy to send out a memo, maybe could we set a deadline for noon on Friday so that we have time to put that information together so that you have a package to look at?
Sure. That sounds like a great idea. Yeah.
Can people- what's today's Tuesday night, so that's noon on Friday.
So yes, yeah, when there's possible money, they can do it fast.
Yeah, all right. Yeah.
2.5 days.
Yeah.
Now it's like, it's Monday. Okay,
Yeah.
that's right.
Yes. Awesome. Thank you.
Or, I could change it to noon on Monday, I guess, to give us the thought process. If we're not meeting till Wednesday, I just would like have information presented to you.
Yeah.
Actually to be more efficient with everybody's time.
Yep. And we might give us some time to fit them into categories where they might apply, and then we can discuss whether they may or may not apply, and the reasons we would think they didn't or did apply. Awesome. Yeah, how about Monday? Can we do Monday at noon? Does that press you guys too much? Because that gives people the weekend.
Yeah. I think
Okay.
that works.
Super.
And
Thank you,
I
Bailey,
wanna
for
say that
knowing
there's
that.
probably no-
Thank you, Tracy, and thank you guys for being willing to be flexible on that meeting on Wednesday. And then item 29, excuse me, approved payroll and vouchers for August 2021.
I move that we approve payroll and vouchers for August 2021.
Second.
Moved and seconded. Any further discussion? Hearing and seeing none, all those in favor signify by saying aye, please.
Aye.
Aye, all those opposed, same sign. Motion carries. Seeing no more business before the Albany County Commission on August 17th, 2021. I adjourn the meeting. Thank you all and have a nice night, and we'll see you guys next